How are lipid disorders diagnosed by healthcare professionals? Have you ever wondered how healthcare professionals figure out if someone has a lipid disorder? It all starts with a simple blood test known as a lipid profile or lipid panel. This test measures various types of lipids in the blood, including total cholesterol, low-density lipoprotein cholesterol, often referred to as bad cholesterol, high-density lipoprotein cholesterol, known as good cholesterol, and triglycerides. When levels of low-density lipoprotein cholesterol and triglycerides are high, or if high-density lipoprotein cholesterol levels are low, it can signal a lipid disorder. This condition can increase the risk of serious cardiovascular diseases like atherosclerosis, heart attack, and stroke. The process usually begins with a healthcare provider asking about your medical history. They will want to know if there is a family history of cardiovascular disease, your lifestyle choices like diet and exercise, and any symptoms you might have. To ensure accurate results, you may be asked to fast overnight before the blood test. However, some lipid components can be measured without fasting. The standard lipid profile includes four key measurements. First, total cholesterol represents the combined amount of cholesterol in your blood. Second, low-density lipoprotein cholesterol contributes to plaque buildup in arteries, which can lead to heart problems. Third, high-density lipoprotein cholesterol helps remove low-density lipoprotein cholesterol from the bloodstream, acting as a protective factor. Finally, triglycerides are a type of fat stored in fat cells, and high levels can increase cardiovascular risk. In certain situations, healthcare professionals may recommend advanced lipid testing. This goes beyond just measuring levels. It also looks at the number and size of lipoprotein particles. This detailed assessment can provide a clearer picture of cardiovascular risk and help guide treatment decisions. Sometimes, additional tests are necessary to rule out other causes of abnormal lipid levels, such as thyroid, liver, or kidney diseases. Healthcare providers may also calculate non-high-density lipoprotein cholesterol, which includes all atherogenic lipoproteins. This can be measured even without fasting and is useful for assessing overall cardiovascular risk. In summary, diagnosing lipid disorders involves a combination of a thorough patient history and blood tests that measure cholesterol and triglyceride levels. Advanced testing and further evaluations help tailor treatment plans to reduce the risk of cardiovascular issues associated with lipid disorders.